how is the PG doing in the clinic?
Good afternoon. How many of you here are already familiar and using the OCEX?
Yes.
Okay, wonderful. So I'll be interested to know your feedback and what your experience has been. For those of you who are not familiar, I'm going to, the next few minutes, explain what exactly the OCEX is, the Ophthalmic Clinical Evaluation Exercise. So that's what the OCEX looks like, and it's undergoing some revision right now. And if you look at it, it's basically an observed encounter between a PG and a new patient. The evaluator should be present in the exam room for the entire interaction. That is, you, the teacher, needs to be present there. The intent is to rate the PG in all the categories listed below and then provide immediate performance feedback. And the rating system, it goes from 1 to 4, 1 being does not meet expectations and 4 exceeds expectations. Not everything is applicable, because this is based on an American system of examining patients. Some of it is not applicable to us, and that's okay. So it's divided into 4 sections. The first section is the history taking, the interview skills. So it goes as the resident introduce self, obtain the chief complaint, history of present illness, pertinent negatives. Pain inquiry is not something we do here. How about allergies? Review of systems, which is from head to toe. Medication list, past medical history, social history, family history, and did he or she wash hands? The next examination is best corrected vision, pupils, including RAPD, visual fields, ocular motility, external exam, slit lamp exam, intraocular pressure plus or minus gonioscopy as indicated, and fundus examination. The third and fourth segments are about the interpersonal skills and professionalism. Was the student empathetic towards the patient? Respectful and courteous? Tried to use language the patient understands? Explain the findings to the patient? Explain the diagnosis, the plan, the options, and asked at the end if the patient had any questions. And at the end of all this, he or she presents the case to you, and the case presentation is also rated as concise and clear, pertinent facts, pertinent negatives and positives, appropriate differential diagnosis was generated, appropriate plan, and the response to you, the attendings, questions and suggestions. So this goes with descriptors for each stage, and this is what the descriptors look like. For instance, if you look at, for instance, pupils, number 1 is does not check, number 2 checks light reaction, does not swing the light, 3 checks light reaction and for RAPD, and 4, which is exceeds, does additional appropriate testing relevant to patient's history and exam. So every level, visual acuity, pupils, visual fields, and so on, has a descriptor according to the level of competence. So let's try grading. What do you say? So let's look at this resident. This PG is examining the pupils. That's it. So when I told the PG, examine, pupillary examination, this is all the PG did. Swing back and forth, back and forth. What do you think? So let's go back and try and see if we can rate this one. Do you think he's a 1? How many of you here think he's 1? 2? 3? 4? Does anybody think he's a 4? No. Would you agree he's somewhere between a 2 and a 3?
Yes.
Right. So he didn't evaluate for anisocoria, didn't look for accommodation, just only swung from one to the other, right? So, but this immediately tells you the postgraduate's ability to examine the pupils. And so at the end of this encounter, you sit them down and say, hey, this is not how you examine pupils. What you did, this was right, and what you didn't do was this. So the OCEX can be used for immediate feedback. Why use a rubric? So this descriptor system that we use, where we divide everything into levels of competence and and give a descriptor for each level, why do we use a rubric? Because teaching is not equal to learning. So I just put some stills here to show how I do it in my clinic. So I'm sitting quietly in the corner. This is actually my room. I'm sitting in the corner, and these are obviously a patient, somebody trying to pretend to be a patient. That's why she's smiling so widely. So here, the patient enters, and I am observing my PG ushering in the patient and introducing himself. After which, I actually tell the patient, because it's a private hospital, I tell them that this is a quality check. And this is a very competent PG, but I'm required to do a quality check, and because these are your future doctors. And so patients are very happy with that. And I just tell them I'm going to be quietly sitting in a corner with my pad. So I have the OCEX on my clipboard, I'm sitting and observing. So the PG does everything, vision check, refraction, and just for the patient's sake, I get the refraction rechecked. I also recheck all the findings. The anterior segment slit lamp exam, the fundus exam, everything is rechecked. At the end of it, the PG presents the whole case to me, and I give immediate feedback. This cannot be done every day. Don't get me wrong, we don't have so much time in Shankar Netralaya, but we usually do it once a year during their training. So they have something called the GOPD month, where they do the entire workups and management by themselves. At the end of the month, one day, my half-off day, I sit and I will do an encounter, the OCEX encounter. So, but it's no suspense. We give the OCEX sheet to them. Look at it. This is what you're going to be graded on tomorrow. They still will make so many mistakes. So that tells you where they are and gives you an opportunity to tell them right away. In assessment of rubrics, the OCEX attempts to make assessment objective. So you don't say, that's terrible. What you did was horrible. I cannot imagine. I don't know how you're going to be. You're going to fail. You don't have to say all that. You have objective, exact descriptors that tell you where he or she is at for every test. Helps the assessor with specific examples, tells the student what is expected, provides opportunity for prompt, structured feedback. Thank you.